I want to start by just reminding us about, the ongoing COVID-19 pandemic and how really we haven't been impacted all the same by COVID as well. And one group of people which has been disproportionately impacted, without a doubt, has been older adults, because we know that seniors actually account for 93% of COVID deaths so far in Canada. And early on in the pandemic, of course, we saw what was happening in long-term care facilities, especially for-profit long-term care facilities, where there was essentially a humanitarian disaster which unfolded and led to some of the worst outcomes among OECD countries. One of the major reasons for that is that our system is simply not designed to look after aging people as they're getting older, to provide them the proper geriatric and palliative care that they deserve. This is just not how our system is designed. And to talk a little bit about the funding model, I can share with you that several other comparator countries, OECD countries like Denmark, the Nordic countries, Germany, they actually fund community-based elder care services like home care and long-term care at about double what we do. So in many of these countries, especially Denmark, which many people consider one of the gold standard countries in terms of how care is delivered for older adults, about half of their community elder care budget is going towards supporting people in their own homes, where in Canada, it's only 1/3. Or perhaps even less, once again, depending on where you look at the numbers. So we are underfunding this entire healthcare sector. And out of the funding that we are dedicating to this sector, we are disproportionately funding long-term care institutions rather than home care. When we're talking about the healthcare system, this is vital because our healthcare system does not work in isolation or silos. It works more like a circuit. So underfunding in home care definitely is a major contributor to why we have overcrowded emergency rooms and why we also have an ALC crisis in our country as well, where people are waiting for discharge out of hospital but don't have beds in places like long-term care. We know that without any action from our governments, the crisis will only get worse. For example, baby boomers, our largest age demographic, turned 75 in 2021, and this age group is slated to double in the next 20 years. We know that right now, actually 1 in 5 Canadians is over 65. And compared with the rate of growth for the overall seniors population, the older seniors population, actually the subset of seniors who are 75 and older, or even 85 and older, is growing at a faster and faster rate. What this means is that there will be more and more people who need support. And the Canadian Medical Association has estimated that the number of people who rely on home care is expected to increase by more than 50% in less than a decade. Canada is actually one of the few countries, or perhaps one of the only countries amongst those comparator countries I was speaking to, where the care is very reactive when we speak about home care. So what that means is we wait for someone to experience a fall or someone to have a critical medical event, and then we deploy home care services in place. We are not really using a preventative approach where we're sending physiotherapy, rehabilitative resources to support people to age well and live in their own homes, which are available in other countries. Also, in Canada, you have to be, once again, needing help for intimate care activities like bathing, putting on your clothes, feeding, before you can get home care. In other countries, it could be as simple as needing some help with the shopping or needing some help with the laundry, what we call instrumental activities of daily living when home care starts. But moving ahead, our strategy can simply not be to do more of the same. 96% of seniors, as per a recent survey by the National Institute of Aging, actually want to remain in their homes for as long as possible. And we know that close to 90% of people in Canada actually want to experience end of life in their own homes for as long as possible. So home care is a solution which is not just cost effective, but is actually in line with what people want. And we need to make sure that there is ongoing collaboration between all political parties and jurisdictions to make sure that home care is in the spotlight, and we have universal, accessible, comprehensive home care services that allows people to receive the care that they deserve.